You're welcome to my channel. Thanks for visiting. Today I'll be addressing semaglutide, and that will come under different brand names. It's either Ozempic, Wegovy, or Rybelsus. Don't worry, I'll go into details as per each of them. Please remember to subscribe if you have seen for the first time. But if you are familiar with my channel and you are visiting again, I'm saying a big thank you. At the end of this presentation, please remember to leave your comment, thumbs up, and share with all your friends on all the platforms. Without further ado, let's go. Let's note that semaglutide under the brand name Ozempic, Wegovy, or Rybelsus is meant to help people with type 2 diabetes mellitus and individuals with excess weight that will need to share the weight. But we have a big problem. Majority of the people with type 2 diabetes mellitus and excess weight can no longer afford it. With that, it is very, very expensive. And it is in short supply. Some will be wondering, why is it that the medication that is helpful this much will be in short supply? And I'm trying to say that it's very expensive. If it's expensive, then it should be there, in pharmaceutical stores, and people will not be able to buy it. Do you know the answer? The rich could buy it. They could buy it easily. So a lot of people who would like to shed weight, even when they don't have type 2 diabetes mellitus, could afford it. While majority who are down with type 2 diabetes mellitus or who are obese and will need this medication can no longer afford it. Therefore, another problem is here. Fake brands are there online. Counterfeits are there. Some countries are even contemplating on placing ban on some brands in their jurisdiction. Let's go through a brief history. A Norwegian company in Norway, known as Novo Nordisk, started it all. It started in 2008 as per semaglutide under the brand name Ozempic. They brought it out in 2012 and they took it through several trials. And by 2017, United States FDA approved Ozempic for the treatment of type 2 diabetes mellitus. In 2018, European Union approved its use also in the treatment of type 2 diabetes mellitus. Rybelsus followed. They produced Rybelsus as a powder form of semaglutide. By that time, Japan, Australia, and some other countries have approved its use in the treatment of type 2 diabetes. In 2021, United States approved Wegovy for the treatment of obesity. Boom! That became a big changer in the treatment of obesity. And in 2022, European Union followed suit by approving the use of Wegovy in Europe for the treatment of obesity. Then we ran into trouble. Illegal sales of this medication became rampant. In fact, some countries like Belgium is contemplating placing ban on the use of this treatment or on the use of this medication for the treatment of obesity. Why that? Some people who are rich enough and who could afford it are getting it. They could buy it, while many people with type 2 diabetes mellitus or those with serious obese conditions cannot even afford it. Semaglutide will come under different brand names like Ozempic, Wegovy, or Rybelsus. As per classification, It is a peptide, a glucagon-like peptide 1 receptor agonist. Is one of those medications now for the treatment of type 2 diabetes mellitus and also for the treatment of obesity. Forms. Semaglutide will come under different forms based on the brand names. Rybelsus is the only per oral form, in form of tablets, under different strains like 3 mg, 7 mg, or 14 mg. The remaining two, that is Ozempic and Wegovy, will be in solution form for subcutaneous injection. You could see the strength here also. Now, how do we administer this medication? Rybelsus, like I have said earlier, is the only per oral form. It will come in the form of tablets, as stated, in 3 mg, 7 mg, or 14 mg. We will take this tablet with water. But note this. Please, let there be at least 30 minutes before the meal or before any other medication that you are going to take per oral or any other items. You can take whatever is compatible with Rybelsus after 30 minutes of the ingestion. Please take this tablet whole. Don't crush, don't break it. It is better you start with 3 mg once daily, and that should be taken for 30 days. Then you review, and then increase to the next strength, which will be 7 mg once daily. However, this is not rigid. Remember, you are dealing with diabetes mellitus and you are dealing with human being that is not rigid. The system is dynamic. If the individual taking this cannot tolerate it, or the glucose level is fluctuating negatively, or side effects are becoming troublesome, you don't have to follow this rigidly. You can alter anything before 30 days, please. If you need 14 mg once daily, please don't use 2 of 7 mg tablets. Do I make myself clear, or I need to explain further? Let me explain further. If someone says, oh, since I don't have a single 14 mg tablet strength around, I have 7 mg per tablet, then take 2. No. 14 mg tablet is meant for 14 mg tablet once daily, not 2 of 7 mg tablet. Now, when it comes to Ozempic, these will be given subcutaneously. It's a solution for injection. You can start with Ozempic injection in 0.25 mg dose pen once a week for the next 4 weeks. Then you will review with the glucose level after 4 weeks. But like I've said under Rybelsus, you might not have to wait for 4 weeks. Nothing is rigid in medicine because human body is dynamic. It's not static. So it depends on the value of glucose. If it's favorable, if we are winning, fine. If not, you make adjustment as it is appropriate. We can increase to 0.5 mg once weekly, and maybe not, or even higher, depending on the value of the glucose. The key is that we're titrating. We're titrating the dose up, or we remain at the same dose based on the general well-being of the patient before us and evidence already gotten from the blood glucose level. And of course, since we are dealing with human beings, not a piece of machine, we'll take history. How are you doing? Any improvement? In addition to the weight fluctuation, in addition to the physical examination and all other factors. So this is the pattern we have to take, but nothing is rigid. We're titrating. When it comes to Wegovy, it's similar to Ozempic, but there's a slight difference. We will begin with 0.25 milligram dose pen subcutaneously every week for 4 weeks like we found in Ozempic, but you don't have to reach the 2.5 milligram if the individual cannot tolerate it. Then you reverse. We will titrate as below. That's why I said there's difference between Wegovy and Ozempic when it comes to administration. Though the same pattern, but the frequency and the dose will vary. Like higher dose is meant for weight loss compared to the dose we will give for the treatment of type 2 diabetes. 0.25 milligram every week for 4 weeks, then 0.5 milligram every week for another 4 weeks, then 1 milligram, and we continue like that till we reach the maximum, which is 2.4 milligram every week, times indefinite period of time. But we will not leave the patient unattended to. We continue to take history from the patient, physical examination, or as the patient may choose, because majority will use Wegovy to deal with weight. You don't have to reach the 2.4 milligram if the individual that will take the medication cannot tolerate it. We can even reverse to lower dose. So history, physical examination, glucose level, weight level, diet, everything must be put together. Still on administration, when it comes to Rybelsus tablets, like I've said, 30 minutes before the first meal or any other orally ingested item or items, please let there be 30 minutes apart. Okay? You can take whatever that is compatible after the 30 minutes of the Rybelsus tablet ingestion. When it comes to Ozempic or Wegovy, you could give Ozempic or Wegovy without consideration or regard for food. But I, as an individual, a physician, my own decision would be that I would prefer that it is given close to meal time. Remember, it's going to deal with glucose. Very soon we'll get to mechanism of action. Okay? It is better to select a particular day of the week for the weekly injections. And with that, just for consistency. For example, when we say, okay, you'll be taking this weekly, why not choosing every Friday, every Saturday, every Sunday, or every Monday? Let's examine the mechanism of action of semaglutide. It behaves like incretin and incretin mimics. I'll get into the two shortly. How about that? Remember, this is glucagon-like peptide 1 receptor agonist. In the pancreas, it will do two things. It will work on beta cells inside the pancreas to produce more insulin. And that way is going to reduce the glucose level. In the same pancreas, it's still going to work in a way to reduce glucose level by working on alpha cells of islets of Langerhans. reducing the production of glucagon. Remember I said on beta cells of the same pancreas to produce more insulin, shoot insulin into the circulatory system. Inside the same pancreas on alpha cells to reduce the production of glucagon. When glucagon is not active, there will be less glycogenolysis. That is breaking down of the stored glycogen from the liver to give us more glucose. So less gluconeogenesis. So less glucose is produced in two forms, insulin and less gluconeogenesis. That is how it's dealing with diabetes. How about obesity? It is capable of suppressing appetite and food craving, so you eat less, and also decrease gastric emptying and digestion. So less is finally digested and less is absorbed into the system. By these two ways, weight reduction could be achieved. Incretin. By definition, this is a metabolic hormone. It will be produced after food, postprandially released. The level of blood glucose that will rise after a meal will lead to the release of incretin or incretins. Then, the incretins will work on the pancreas. Inside the pancreas, we have beta cells, alpha cells. The beta cells will be responsible for the production of insulin. The incretins will help to shoot the production of the insulin. While on the alpha cells, it will work to reduce or inhibit the production of glucagon. And remember what I've said about insulin and glucagon just a few minutes ago, right? You can pause and rewind. I don't want to take all your time. They have the capability to slow down the rate of absorption. Remember what I've said earlier? Therefore, they do that successfully to reduce weight by decreasing gastric emptying rate and also decrease food intake. We have two examples. Glucose-dependent insulinotropy polypeptide is also known as gastric inhibitory peptide. These will be produced by kale cells in duodenum and jejunum. The other example is glucagon-like peptide 1. These will be produced by L cells in both small and large intestines. Incretin mimesis. We can call it incretin mimics, something that mimics another thing. I have just finished explaining some facts about incretin. To save the time, let's just pause and rewind and get that. So briefly, incretin mimics will act like incretin hormones. Example is they will act like glucagon-like peptide 1. They will bind to the receptors meant for glucagon-like peptide 1. And they have the capability to act on the pancreas, on two cells there. 1, beta cells to produce more insulin. Also alpha cells to inhibit or block production of glucagon. And what are we going to get from that? Insulin will control the excess glucose, bring it down. While the glucagon that is being blocked will lead to less glycogenolysis, meaning less breaking down of glycogen into glucose, and more glucose production, so less gluconeogenesis. By that, glucose level is kept under control. It also has the capability to suppress appetite and slow gastric emptying. So let's quickly go through some few examples here. It won't be surprising if we find Rybelsus here. We're going to find Rybelsus. We will find Wegovy. We will find Ozempic, Trulicity, Victoza. We're going to find all these like Saxenda and so on. So that is all about incretin mimetis, and that should cap the mechanism of action of semaglutide under Ozempic, Wegovy, or Rybelsus. Drug-drug interaction. Those who are familiar with my channel will know that I don't talk much about this because the list could be pretty long, and I may not be able to tell precisely what medication or medications you might be taking. So it is better to open up to your physician or pharmacist. But let me quickly touch on the use of diuretics that will increase the probability of dehydration. Someone on insulin should please tell the truth, because if you are taking insulin with semaglutide, you are running the risk of profound hypoglycemia. Or if you are taking any other oral hypoglycemic agent like metformin or any other one for that matter to deal with diabetes mellitus, please furnish your doctor with such pieces of info. And some over-the-counter medications, and the best is tell your physician, tell your pharmacist, so that it can help you with the drug-drug interaction. Uses of semaglutide. In type 2 diabetes mellitus, we use it, though not too high dose compared to when we need it for weight loss. But remember that in type 2 diabetes mellitus, we must start with diet control and exercise. It is when we are not winning that we'll start thinking about semaglutide. In obesity, in fact, it has gained ground above all other medications that could be used in obesity. It is second only to bariatric surgery in handling obesity. The dose here will be a bit higher than the dose meant to handle type 2 diabetes mellitus, and it's likely going to be on long-term basis. But we must also add diet control, that is, we modify the lifestyle, right? Diet control and exercise, including other factors that could help in reducing the weight. When it comes to pregnancy or breastfeeding, it's easy. My own answer to my patient will be no. No semaglutide with pregnancy. As a matter of fact, 2 months before pregnancy, no semaglutide. When it comes to breastfeeding and semaglutide, preferably, I would say don't take it. Contraindications, meaning the condition or conditions when we cannot use Ozempic, Wegovy, or Rybelsus. When there's a problem with the thyroid gland. How do I mean? When there is thyroid gland cancer, or the probability of thyroid gland cancer, we will not use this medication, because thyroid gland cancer could be a problem due to the possibility of glucagon-like peptide 1 mediated thyroid cell hyperplasia. Therefore, we will not use this medication in anyone with medullary thyroid carcinoma that is already diagnosed and is ongoing, or there is that positive family history of medullary thyroid carcinoma in this individual. Also, in men type 2, we will not use Ozempic, Wegovy, or Rybelsus. Still on contraindications. When it comes to the age, we will not use this medication in anyone less than 18. In pancreatitis, no. In type 1 diabetes mellitus, no. Diabetic ketoacidosis, no. When there is diabetes mellitus retinopathy, no. I've just gone through pregnancy and breastfeeding. 1. We have to keep an eye on the neck region. What are we looking for? We're looking for thyroid enlargement. And we will also check for signs and symptoms of thyroid pathology. We must warn against diabetic ketoacidosis. And if you want to know more about diabetic ketoacidosis, kindly click on this link. That is not enough. We will keep an eye on the renal system. Why that? It is excreted in urine and feces. The pancreas will be closely monitored. Why that? Beta cells producing insulin is one of those places where this medication will work to shoot the insulin out, and alpha cells also in the same pancreas producing glucagon is where this medication will work. How about that? Because it's going to inhibit the production of glucagon. So the pancreas must be working. That is why it is contraindicated in anyone with pancreatitis. Cardiovascular system. Fortunately, in anyone with type 2 diabetes mellitus, this medication is helpful when it comes to cardiovascular system. Ophthalmologists will be included because of retinopathy due to diabetes mellitus. And pregnancy, we will have to screen that woman of childbearing age with beta-chronic gonadotropin acid to be sure she's not pregnant before placing her on this medication. Now, let's consider the side effects. But we might not be able to tell all the possible side effects at this moment. And why that? These medications are still new to the market or to the whole world. We don't know what we may be seeing in people using this medication in the next 20 or 50 years. Remember, from the history, from Norway, the whole story started in 2008. And up to 2017, before Ozempic was first approved by FDA in the United States. So it's still pretty new. We don't know what will happen in the next 4 or 5 decades. For now, we have the following as a possible side effects. When it comes to glucose, the level is expected to drop. That is the expectation. But it might drop profoundly. That will lead to the possibility of treatment in the situation of bad hypoglycemic states. These will become a problem in anyone who will be skipping meals. When the glucose level drops, we'll be faced with 2 possible conditions. Adrenergic symptoms will first of all set in with hunger, tachycardia, sweating, tremor, and so on. Then neuroglycopenic symptoms will set in if that is not corrected on time. Confusion, disorientation, dizziness, and even coma. And that is why anyone that is on treatment for diabetes mellitus should be educated on how to handle the side effect, hypoglycemia. As a matter of fact, hypoglycemia will kill faster than hyperglycemia. So, they have to get lifesavers. Get a bottle of Coke somewhere, some sweet, anything like that that could help them in their backpack anytime they go out. So, like we would do, while treating anyone with diabetes mellitus, we're repeating the same here. Hypoglycemia is a possibility of side effects of any medication that will treat diabetes mellitus. Central nervous system will not be spared. We can have headache, dizziness, tiredness, even from the hypoglycemia when we are dealing with neuroglycopenic symptoms, confusion, disorientation, dizziness, or coma. I put it down here, psychiatric conditions, in the sense that there may be probability or the possibility of mood changes and suicidal ideation. So we keep an eye, please. When it is about gastrointestinal tract, we may be faced with nausea, vomiting, and diarrhea. Remember, we have said earlier, as part of the mechanism of action, that there will be decreased appetite. When it is about endocrine, we've said earlier, we should look at the neck for the possible thyroid enlargement. Here, there may be thyroid swelling, and that could cause pressure effect, like hoarseness of voice, dysphagia, or even shortness of breath. Still on endocrine pathology, as possible side effects could be pancreatitis that will present with pain that will radiate to the back. And with that, this medication is going to work on the pancreas beta cells and pancreas alpha cells. On the cardiovascular system, there may be tachycardia, either from the hypoglycemic state or because there's trouble with the cardiovascular system itself. But generally, or broadly speaking, this medication is pretty helpful in many ways, including cardiovascular system in individuals with type 2 diabetes mellitus. And the individual can even have lightheadedness. The gallbladder could be affected. And in that case, there might be fever, abdominal pain, even jaundice and steatorrhea. The kidneys. What will happen to the kidneys here? Remember, the kidneys will be the route of excretion, including through the feces, right? Urine and feces. We should watch out. There may be damage to the kidney, and renal failure will lead to massive edema, anasaka. And renal failure can lead to oliguria. And when it is profound, it can lead to anuria. Then, when we consider ophthalmology, there might be visual changes. And last but not the least, as per the side effects, is the possibility of hypersensitivity that could present with itching hips, dizziness, increased heart rate, drop in blood pressure, swollen lips, tongue, throat, and face. Please don't die too fast. Don't die too young. Call 911 immediately. The side effects you are passing through might have not been listed here. These medications, Ozempic, Wegovy, and Rybelsus, are still new to us. Document it by reporting to your physician, and that will be posted later on by World Health Organization or the pharmaceutical company. Finally, since medical world is dynamic, like those who graduated from medical school or nursing school till the year 2016 might not know much about this medication. Today is out there. Ozempic, Wegovy, Rybelsus. pretty new and extremely helpful. The world of type 2 diabetes mellitus has turned for good. The world of obesity treatment has turned for good, because this medication is second only to bariatric surgery in handling obesity. Watch out for the counterfeit or fake forms of this medication online. Therefore, I will personally advise stick to doctor's prescription and referral to pharmacy. Don't buy this online, because it might be dangerous. Some put insulin in this. Imagine somebody putting 2.5 milligrams of insulin and you take it once. You know what that could be? Please stick to doctor referral to pharmacy, prescription only. Save your life. Help others. Spread this news. Spread this presentation. It's a helpful medication, and I will end by appealing to the rich, to the wealthy, to those in power, those taking decisions over the head of everyone in the world, to help the pharmaceutical companies to produce more of this medication, to block all the channels and loopholes for the counterfeit supplied to people, and reduce the cost by any means possible, through which that could be done. Thanks for listening. Please share this presentation with everyone on all the platforms. I appreciate it.